if you eat this much, you need to exercise this much, then it's balanced. If you're eating this much and you exercise it like this, the remaining jara is going to be stored as fat. What's up, beautiful people? Welcome to another exciting episode of New Mom with Dr. Who you already know. And today I'm back at you with another exciting and controversial topic as usual. Yeah, I'm sure you can already see from the title or the thumbnail, we're talking about the big question: do hormonal contraceptives make you fat? So I get this question a lot from a lot of my patients, from family, friends, and I've also heard the same thing from my family, friends, and patients, that using hormonal contraceptive will make you add weight, it will make you fat, it will make you big, it will make you this, it will make you that. But how true it is? Let me tell you a secret. Fun fact: personally, before I started having kids, I also heard this. So many horror stories about it, that if you use it, it will make you fat, if you use it, it will make you this. And I don't want to hear any story. Like, I know one story. I didn't want to use myself as experiment. So once I decided I was done with having babies and my family size was complete, I just went for the copper IUCD. That one is non-hormonal. It's a non-hormonal form of contraceptive. So there's no question of weight gain or weight gain. I just know that if I add weight, then it's not the contraceptive, right? It's something else. So I don't want to use myself as an experiment because I know I'm so lazy to exercise and all that. I suck at it. So I didn't want to have to go through all that, which is why I just went for something headache free as far as I was concerned. Anyway, most people actually like and prefer to use hormonal contraceptives, but some don't want to have to deal with the supposed side effect of weight gain, right? So people want to know before they go or make their choice about what type of contraceptive to use, because a lot of the contraceptives available are all hormonal. We're talking about the oral contraceptive pill is hormonal. Contraceptive injection is hormonal. Hormonal IUCD, that's the Mirena, is hormonal. Do you get? So a lot of all these things we're using, they are hormonal. The non-hormonal, the options are limited. You only have the copper IUCD, then the short-term ones like the spermicides and condom, barrier methods and all that, like cervical cap and diaphragm and all that. But every other thing is really hormonal. So it's like, okay, options are limited if you choose not to go the hormonal route. So if I want to go for the hormonal route, am I going to add weight? Because really, you weigh your options. Adding weight, not getting pregnant, which is better. If you get pregnant, you might add weight. If you don't get pregnant, you can still add weight if you use hormonal, right? So let's answer the jam question today. Okay, so studies have shown that, drum roll, when you use hormonal contraceptives, there is no evidence to show that they actually make you gain weight. Yeah, so studies have shown that they don't actually make you gain weight. So the thing is that when most women are using hormonal contraceptives, they're at a stage in their life where for most people, that's when your metabolism starts to slow down. So your body is not able to digest food as fast and all that. And that, of course, leads to weight gain. So because it's coincidentally the time you start using hormonal contraceptive, you attribute it to, oh, it must be the contraceptive that is causing it. And then you stop the contraceptive and you're not seeing any change, right? But studies also show that you might actually see an increase in your weight, right, when using hormonal contraceptives. And this is because some of these hormonal contraceptives actually cause fluid retention. So it causes you to retain more fluid or more water in your body. And of course, water and fluid has weight, so you will see that your weight is increasing, right? But they also said this is temporary. So after a while, that fluid retention stops and your weight goes back to normal. So if you are seeing a temporary weight gain, yes, it could be due to the hormonal contraceptives. But if that temporary weight gain becomes permanent, maybe it's not due to the contraceptive. Another thing the study shows was that the hormonal contraceptives, they could make you have an increased appetite. So you're eating more than you usually eat. And of course, when you eat more, guess what happens? Your body stores all that food as fat, and you become bigger and you gain weight. So it may not make you gain weight directly, but it might be making you do something that will make you gain weight, right? So that's also another thing to consider. Then another thing is, for a lot of women, you might be blaming it on the hormonal contraceptive, but have you considered the fact that, one, like I said, your metabolism has probably slowed down, so you're not able to digest food as fast as you usually do, or as fast as you usually did before you reach this stage of your life? That's one factor. Maybe you're not as physically active as you used to. Before, you were a young person jumping boats anyhow, but you now got married, your husband got you a brand new car, or you're now a top executive, you got yourself a car, so you don't walk around, you now drive around. you're less physically active. Have you considered that might be a factor? Then also changes in your diet. You're eating more eba, amala, starchy foods filled with carbs and less proteins. That might actually be making you add weight, because carbohydrates, sugars, they get stored in the body as fat. So are you considering that maybe that's it? Or it could even be that you're eating more as a result of the hormonal contraceptives or not. You're probably eating more. Have you considered that you're eating more than you usually do, and you're not exercising as much as you're eating? Because it's a simple balance equation for maintaining a healthy body weight. If you eat this much, you need to exercise this much, then it's balanced. If you're eating this much and you exercise like this, the remaining jara is going to be stored as fat. Same way, if you're eating like this and you're exercising like this, you're going to burn all the fat and there's going to be nothing left, right? If you're trying to lose weight, you eat less, exercise more. If you're trying to gain weight, eat more, exercise less, right? Is an equation. And if you just want to maintain where you are, eat, exercise the same. So exercise is good, but if you're not able to exercise, physical activity, climb the stairs, don't use the elevator, walk, don't drive, don't use remote, get up, go and change that channel on the TV, those kind of things, right? Make sure you are moving. You're not an object, you're a human being. Move. You get what I'm trying to say? Okay, that's just me being silly, but you get the point actually. So in conclusion, there is no evidence to show that hormonal contraceptives make you fat. The weight gain you're experiencing is probably due to other factors which I discussed in this video. If you enjoyed watching this video so far, don't forget to click the like button, subscribe, and share with anyone you think might need to see this. Remember, being a new mom can be pretty overwhelming, but your kids are totally worth it. See you next week.